South Africa now has 10 medical schools. The newest is the Nelson Mandela University Medical School. The university accepted its first cohort of 50 students in March and will increase that number to 81 next year. It's hoped the facility will boost health services in rural areas. The Health Minister, Joe Phaahla, says the opening was an investment in universal health coverage. But let's get more now from the Higher Education Minister, Dr. Nzimande, joining me now for that conversation. How important was this, is this opening of the 10th medical school in the country, Dr. Nzimande, in the context in which leading with science in response to diseases and viruses has become ever more crucial?
Sizo, thank you very much. Thanks for inviting me, and good morning to your viewers and listeners. It's an absolutely important and historic development that we are adding the 10th medical school in our country, because we are, to be quite honest, running very short of medical schools. We are training far less in numbers in terms of medical practitioners, as well as need for training in other health professions, whether it's laboratory assistants, whether it's radiographers. We are still training far less. And also, by the way, this institution is using some of the most advanced technologies in order to be able to do this, which is important, by the way, even in now producing new kinds of health professionals that we haven't really been able to train, like medical engineers, which is a relatively new profession. The whole issue of health data analysts, that's also a relatively new profession. So this is very, very important. But also the significance of this Sizo is that it's the first medical school that is in a township, right next to also not just your formal township, but informal settlements, which means it's very uniquely placed to actually learn from and address the conditions of the people that it is serving in the immediate sense. For instance, I welcome the fact that it's a unique medical school because its focus right from the word go is on primary health care, which means that it's going to be focusing on preventative rather than curative medicine, which is very important in terms of better managing our health system. Of course, obviously, being located where it is, your bright kids who are able to actually qualify to do medicine at university, they will be able to study next to home, which is something also that is very, very important. But the establishment of the school, of course, as you say, your quoting Minister of Health, is going to contribute significantly in terms of training the much-needed health professionals. Even more so now, in the wake of the pandemic, the COVID-19 pandemic, and what we've learned about this pandemic, in order to be able to deal with pandemics in the future, as science is telling us that we've now entered the age of pandemics. Creating more training capacity for health workers is very important.
In fact, take it from there, Dr. Nzimande, and talk to me about locating this within the context in which South African scientists have been at the forefront, of not only leading our response as a nation, but as we've seen in the last few days, leading in terms of the understanding of the evolution of the virus globally, with them getting, a commendation from across the globe. How are you hoping that institutions like this one will continue on that tradition?
We want to build this medical school such that also it strengthens its research capacity. That is very important. Also leveraging from the fact that we've already got a very good science foundation in the country. The late Professor Lungile Pepeta, by the way, who was very instrumental in laying the foundation for this, unfortunately passed away due to COVID last year. He was very clear that one of the things he wants to do with this institution is that it must do cutting-edge research in primary health care and in related areas. We see these institutions as building already on the science prowess that we actually have as a country. It's unfortunate, of course, Sizo, that in a way We are being punished by some of the developed countries with their colonial mentality for being in the forefront of very important science discoveries. But we are not going to be discouraged by that. We are going to continue to invest. Insofar as the department is concerned, we are going to continue as the Department of Higher Education and Training to support the institution with clinical grants, which actually enables then practical training of students as forthcoming as health professionals of the future. But also I'm going to be bringing in our Department of Science and Innovation to make sure also that we do support cutting-edge research in a township medical school, more or less unheard of in South Africa, and then be able to understand the conditions of the people which this institution will be serving.
Let me ask you this question then as a parting shot, Dr. Blade Nzimande. How will you ensure that this new, spanking new facility that we are proud of at this moment doesn't deteriorate in terms of its infrastructure and conditions for the medical students there to the levels that we've seen students at the, at Wits University's oral health department complaining about, the residence facilities at the Sefako Makgatho University, which were described as really being shameful, or some of what we've seen, for instance, in similar circumstances at Helen Joseph. It's one thing to open a new facility, it's quite another to keep the others up to standard. How will you ensure that this one doesn't deteriorate the same way?
Tulas is a very important issue that you are raising. Firstly, one of the things that we discussed, by the way, with the Vice-Chancellor and some of the people handling issues of security yesterday, is the importance of building relations with the community. Because in order to secure the institution, you must build a positive relationship with the community. Already, we're very pleased that the new mayor of Gqeberha was there and also was able to see these facilities and committed that he's actually going to work together with the institution. The best security for any institution is to build bridges and build a relationship such that local communities actually come to value what this stands for. Obviously, also the security manager of the campus told me that he was very pleased that the mayor was there, but also is going to be meeting with the police and also meeting with the stakeholders to actually look into the whole issue also then of immediate physical security needs for that kind of institution that is there. So, but also we want to use this opportunity to call upon the people of Gqeberha and Mission Vale to say that institution is such an asset, come closer to it and make sure that it is actually being well looked after, because it's going to change, by the way, even the situation in that community in terms of job opportunities that are there, over and above the study opportunities that are actually going to be made. But building relationship with the local community is a matter of absolute priority, and bring together all the key role players. The province also committed, the Premier is very committed to make sure that the institution is protected. The MEC of Health was also there yesterday. So that is for us a very important matter that we are raising, and we've got to do all we can as different role players to make sure that that institution is kept secure.
All right, I've got to thank you for your time there. Dr. Blade Nzimande is the Minister of Higher Education and Training, telling us about the opening of the country's 10th medical school in Nelson Mandela Bay.